Hey everybody, Dr. Joan Ifland here. Today we are going to be talking about some shocking material on how diabetes can be put into remission. We'll mostly be talking about type 2 diabetes, but also how you can prevent the consequences of type 1 diabetes. I know people think that diabetes cannot be put into remission, but if you believe that, you're condemning yourself to a lifetime of misery and worry, when in fact there is a pathway for putting type 2 into remission and reducing the complications of type 1. So we're going to be going through 4 steps today on how to do that. The first step is to redefine diabetes treatment. Is it really incurable? Does it really condemn us to a lifetime of medication? And step 2 is decide if you want to try to do things differently. It's exciting and there are lots of benefits, but dang, let's go over them. Step 3 is to understand why nothing else has worked, because until you understand why nothing else works, you blame yourself. And then you think that there's no point in trying again. So we're going to then talk about a program that we offer, the Remission Optimistic Community, and it is a pathway. It is a pathway to a diabetes remission lifestyle. So what is the definition of diabetes remission? Is it really just take medication, wait for dialysis, wait for amputations? Is it really just to slow down the progress of diabetes? Or is there a pathway to making it really go away? We, of course, as always, are going to be looking at evidence. So, why do people believe that diabetes can only be slowed down or managed, as they say? Why don't people believe that diabetes can be put into remission? Well, because the diabetes educators tell us that. If you go to the diabetes educators website, that's what you'll see. And that's how many medical professionals are trained to advise about diabetes. But these are communities that depend on pharmaceuticals. And there are lots of pathways to putting diabetes into remission that are not pharmaceutical or surgical. The other reason I think that people think diabetes is not curable is because maybe they've tried. Maybe they've tried to control their blood sugars and they find that they can't. So they start to believe this idea that they're doomed. Well, it takes a very focused expert program to put diabetes into remission. That's it. If you've never been in a specific diabetes remission focused program, well, then of course you might believe that diabetes can't be put into remission. You've got to have the right program. And we're going to be talking about that some more. So let's look at the evidence. Could a hidden addiction to processed foods be actually driving diabetes? Could a hidden intense craving for processed foods be overriding rational thought and driving the diabetes? So if you can get to the origin, if you can get back to, oh, it's those overwhelming cravings. It's those cravings that just drive me crazy. Oh, now you're starting to see maybe there is a pathway to putting diabetes into remission if I can get the cravings to stop. All right, now we're talking, right? Diabetes can be redefined as the consequence of intense cravings for processed foods. All right. Now we're getting somewhere. So one thing I really want to step right out here and say diabetes is not your fault. We know that when the big tobacco companies came in and bought the big food processors in the mid-1980s, they bought Kraft, Nabisco, and General Foods in 3 short years, that they were bringing some kind of an addiction business model with them, because that's what tobacco is. It's an addiction company. These are drug dealers, and it's a particular business model where they hide addictive substances in a seemingly innocent product and then give you lots of coupons to try it out, use it enough to actually develop those intense cravings. And then they advertise the heck out of it. They put it everywhere and they make it really cheap. They did it with cigarettes. They do it with alcohol. They do it with vaping. They did it with opioids. And now they're doing it with processed foods. And since they've been doing it since the mid-1980s, there's really good evidence that most Americans, and increasingly around the world, are now suffering from those very intense cravings that override rational thought. It's not your fault. It's a business model. It's a business model that big tobacco perfected and then brought over to processed foods. And we're all suffering from it now. Okay. Let's talk about what you might gain in a diabetes remission lifestyle program. So we do know that diabetes leads to terrible consequences. The lifespan of a diabetic is 6 years shorter than the lifespan of a non-diabetic. And that diabetes is associated with many other consequences, such as heart disease, stroke, kidney disease, eye problems, dental disease, nerve damage, and foot problems. So, gosh, if you could put it into remission rather than just managing it, you would get some really big benefits. This is exciting. So what we know is that processed foods are the problem. We have studies now where they start with 100,000 people, follow them for years and years. Who gets diabetes? It's the people who are eating processed foods. So it's just obvious. If you want to put diabetes into remission, you stop eating processed foods. Oh, well, if that were easy to do, everybody would do it. But the reason it's not easy to do is because of those intense cravings. And intense cravings are started by a lot of different triggers, signals, food stimulation, stress, strong emotions. Those all start those cravings that lead to eating processed foods that leads to diabetes. All right, now we have a picture of what we're unraveling. Now, why don't other approaches work? Why is it that the medical industry cannot put diabetes into remission? Well, because of the cravings. So when you go to a doctor for diabetes, somebody trained in Western medicine, they're not going to talk to you about craving cessation. They're going to talk to you about pharmaceuticals. That is their training. We love them. We depend on them for a lot. They do a lot of good in the world, but they don't know how to put cravings into remission. If you can't put the cravings into remission, you can't put the diabetes into remission. So now maybe you're getting a picture. Just go to the Diabetes Educator website. You will not see one word about cravings, stopping cravings. Diabetes educators don't know how to do that. They've never been trained to do that. We like them as people, but if you want to stop cravings, to stop your diabetes by stopping the use of processed foods, you would not go to a diabetes educator. They don't know how to do it. You can see it right on their website. Stress is a leading cause of loss of control over processed foods. And if you go on the diabetes educator website, you will not see a lot about stress management. People with stress who are eating processed foods because stress activates cravings for processed foods, they need a surround environment of really, really kind people. The kind people who understand, who have a lot of respect and generosity, who understand the science, who can explain to people what's going on with them. Those are the people who can help put stress into remission and then the cravings. So that is why we offer a program of people who are trained to respond with kindness and compassion and friendliness, but really good ideas, lots of science, people who can explain to you why this is not your fault and give you maybe some ideas that you could use on how to lead a comfortable life. The number one pathway to that diabetes remission lifestyle is to surround yourself with kind, compassionate, understanding people who know that signals start cravings, cravings start use of processed foods, cravings start use of processed foods, and untangling that, reversing that is the pathway to a diabetes remission lifestyle. All right. So if you go to the diabetes educator website, you will also see not one word about how the food industry manipulates us into cravings, how they use media, how they use the internet to trigger cravings. They will not say one word about what it means to live with somebody who's eating processed foods. It's very hard to give up processed foods if everybody around you is eating them, because the brain has an overriding desire to feel normal. If everybody around you is eating processed foods and they all believe that the only thing you can do about diabetes is slow progress and wait for the consequences, amputations, blindness, dialysis, then you're going to believe that too. That's just the way the brain works. But if you are around all day long, and we broadcast 24 hours a day with breaks, then you will believe that diabetes can be put into remission and start to take the right kind of action to do that. Are you surprised? Surrounding yourself with the right people is the pathway to a diabetes remission lifestyle. Okay. Now, here's something that's very shocking, which is that to put diabetes into remission, your glucose has to be stable. So if your glucose is up and down and up and down, that is one of the factors in diabetes. It wears out fat cells. It wears out the insulin receptors on fat cells, liver cells, muscle cells. And then you can't regulate glucose. So how do you stabilize glucose? Oh, well, you stop eating refined carbohydrates. Refined carbohydrates are carbohydrates that have been ground into a powder, like flour or powdered sugar, or made into a crystal, like sugar, or made into a syrup, like maple syrup or high fructose corn syrup or corn syrup. And because they're already ground up, because they're already processed, they get into your system all at once. There's no process inside the system of breaking them down slowly and releasing them into your bloodstream slowly. the glucose gets in there all at once. And now you have a glucose high, you have an insulin release, and you have a glucose crash. You have hyperglycemia and then hypoglycemia. And then in the hypoglycemia, you're driven to eat more because you feel so bad. And now you have hyperglycemia, and that's diabetes. That's wearing out the cells that would take the glucose out of your bloodstream and leaving too much glucose in your bloodstream. Well, you think, oh, well, okay. But are the diabetes educators aware of that? No. Diabetes educators on their website suggested foods include bread, cereal, pasta, dried fruit, and then other addictive foods like dairy. Dairy has 4 different kinds of natural casomorphine in it to put a 100-pound baby calf to sleep, and nuts, which have been shown to contain tryptophan and be converted to serotonin, which is converted to serotonin. It's very clear to me why nothing else has worked. If you're working with a diabetes educator who is telling you to put refined carbohydrates into your system and deregulate your glucose, well, that's why it's not working. That's why your diabetes numbers might be getting worse. It might be why you're trying as hard as you can. You're following all the instructions, and your diabetes numbers are not normalizing. I hope you're getting excited because there are other answers. I don't know if you can see this graph. I'm going to hold it up from my phone. But basically what it shows is the more processed foods a person eats, the greater the chances that they're going to get diabetes. We know the issue is processed foods, but we know that processed foods create cravings that are so intense that it overrides the desire not to eat the processed foods. That's one of the big secrets. Okay. So the diabetes educators focus, they do focus on reducing use of processed foods, but they don't train you in the skills on how to do that, which is the skill of reducing cravings, eliminating processed foods, eliminating stress, and putting diabetes into remission. I hope you're getting excited. Now, we also have seen some claims that bariatric surgery can help with diabetes. But now the studies are in on that, and we know that the benefits just fall away over time. You might get some improvements for a few years, but at the end of that, the diabetes will be right back. Why? Because the addiction is here. It's not in your stomach. There are serotonin receptors in the stomach which do play a role, etc. But the cravings, the massive, overriding, overwhelming cravings, are in the brain. Just operating on your stomach is the wrong part of the body. Okay, so here's the evidence. Cravings come from a deeply embedded addiction to processed foods, which was given to us by big tobacco starting in the mid-1980s. Diabetes comes from processed foods. So putting processed food cravings into remission is the pathway to that diabetes remission lifestyle. All right, I hope you're ready. We're on to step 4, what does work? Now, I have been working in this field of processed food cravings since 1996. I got off of sugars and flours. My own glucose stabilized, and I stopped raging. I stopped being angry all the time. I lost weight. I lost the fatigue, brain fog, allergies, a lifelong sinus infection. All of these things just went away one by one by one. And when I got off of just the sugars and flours, of course, today I know that excessive salt, excessive fat, dairy, certainly gluten, that these are all addictive. Caffeine, food additives, these are all addictive, and they do produce those cravings that override rational thought. So what's the answer? Well, as I said earlier, answer number one is to surround yourself with people who have put diabetes into remission, who are in the process of putting diabetes into remission, who have control over cravings, who have stopped all the craving stimulation, who are hanging out with people who don't eat processed foods, and who feel normal having a super healthy lifestyle. Number one, you've got to find the right people. Okay, so we have figured out how to provide that in a 24-hour-a-day Zoom community, which is then supported by a daily newsletter, a daily 1-hour podcast, an audio podcast, a Facebook group, and then small private messenger groups where you have an advocate assigned to you, a food addiction recovery advocate assigned to you. You can also join specialty groups, people who are just like you, and you just surround yourself with these healthy people who care about you, who cherish you, who want you to succeed, who admire you and respect you, and who use the science to explain why none of this is your fault. That is the answer. It's community. It's having people around you who know you, like you, trust you, and care about you. And people who know how to live a diabetes remission lifestyle. It's exciting, huh? The name of this community is the Remission Optimistic Community. After 27 years of work, and the help of a researcher named Kelly Turner, who wrote the book Radical Remission for Cancer, we have created a program to put diabetes into remission through an online community. So this is a community that you access over your smartphone, over your tablet, over your laptop. And we do run 24 hours a day. We're on for 4 or 5 hours, we take a break, and then we're on for another 4 or 5 or 6 hours, and then we take a break. 24 hours a day, so that you can access friends and comfort, security, calmness easily. You just open a screen, get on Zoom, and if nothing live is going on, we maintain a huge library of very interesting educational videos. You can always open an email and get your podcast for the day. So it's instant comfort, it's instant security, and it's instant sanity, because we do work from original research. You guys probably know I spent 3 years understanding those cravings. They come from processed food addiction. And I know the science, and I keep adding to my database. So you're not going to be just around amateurs who make things up. Oh, I did it this way, it should work for you. No, you're working from research. This shows that this works better than some other approach. Okay, so you just have access, constant access to comfort, education, understanding, patience. People who are very, very kind, if you're surrounded by people who are very kind, you start to be kind to yourself. You just internalize it. And when you're kind to yourself, you don't eat processed foods because processed foods hurt. You begin to make that connection. You break through all the delusion that the culture is so, oh no, processed foods are yummy. Well, processed foods are yummy, like cigarettes are sexy. It's just like, what a delusion. Cigarettes are repulsive, and processed foods, once you get them out of your system and your taste returns to normal, they actually don't taste good. They taste icky. So this is exciting. It's very exciting. All of the people in the Rock, all the hosts are trained. We do our own training. If you're interested in learning how to help somebody else put diabetes into remission, type 2, or stop the consequences of type 1, you can train to do that. You train in how to talk to them, how to lift them up, how to empower them, how to give them confidence. You equip them with the science so they stop blaming themselves. It's really fun to be able to help another person, and we do offer that training. So you're not going to be left with an amateur. You're not going to be left with some nice person who has their individual personal ideas about how this works. No, you're going to be left with a trained host under all circumstances. The the Remission Optimistic Community, also offers a very powerful twice-a-day health creation meeting. Each Rock Remission Optimistic Community contains 25 people. We meet twice per day, once in the morning, once in the afternoon, to talk about what we are doing to create health. And this is key. Now, I will tell you personally, I joined a Rock just 2.5 months ago because I am 71 years old. I've had asthma my entire life. I don't want to have asthma anymore. And I will say in 2.5 months, I have removed the tension from my chest. I am breathing more deeply, more easily, more fully than I ever have in my entire life. Well, there were a bunch of things I needed to change in my life. So I went to these meetings twice a day. I got more movement. It became normal for me to not kind of knock myself out working late into the night. I cleaned up my food to another degree. I really paid attention to even clean foods that seemed to cause that tightness in my chest. I did a whole pile of work on my childhood trauma, of which I have plenty. And I did this, it became normal. I also added an acupuncturist. And I also used Western medicine. I have inhalers, I still use them. So it's this blending, it's this weaving together of Western medicine, acupuncture, talk therapy, and this twice daily meeting where not only are we talking about how we're using, how we're creating health, but we're also talking about a lot of different modalities: meditation, visualization, qigong, coherent breathing, Wim Hof breathing, box breathing, singing bowls, even just energy management techniques like tapping that have been used for centuries effectively. I just kept piling it on. The Rock, with these 2 meetings a day, gave me the inspiration, the motivation, the support. It made it feel normal that I was trying out all these things. And because it's not controlling, as I listened to what other people were doing that worked for them, I got to try them out. If they didn't work for me, I didn't use them. This is so exciting to me. I'm really now like getting used to being in a body where I can breathe deeply anytime I want, where my chest just opens up and I get all the oxygen I can use. I'm getting used to it. It happened in the rock. I hope you're excited. Okay. The other thing about the rock is that it is a schedule that runs for 13 hours a day. It's linked to our original community, the ARC, and that ARC is the community that runs 24 hours a day. So you have lots and lots of flexibility, and you have total control over your time. If you miss the morning health creation meeting, you can go to the afternoon health creation meeting. If you miss them both, no big deal. They're going to be on again tomorrow. The health creation meetings run every day for 4 months. That's 18 weeks. That's getting to know a small group of people, 25 people, really well, and fitting in with them and making it normal that you're trying meditation or visualizations to put the cravings into remission. Maybe you have consequences that you want to put into remission. Maybe you also have high blood pressure. Maybe you have skin problems. Maybe you have heart problems. Maybe you have gut problems, or you have joint problems, or you have excess fat tissue that you want to resolve. This is all going in the same direction. When you have more movement, when you have less processed foods in your food plan, all of the cells in your body start working better. If all the cells in your body are working super well, you don't have disease. So disease happens when cells are crippled, when cells are not working, when cells are too overwhelmed to do their jobs, pump blood, clean blood, digest food. That's when you develop disease. It's very, very cool to think that you could get all the cells in your body to start working again, even hormone issues and reproductive issues. They all result from cells that aren't working. Okay, the other big thing that the rock does is it takes you through a process where you customize your food. Yes, we will give you a list of the foods. It's an honest, clear, evidence-based list of I call them substances. They're being sold to us as if they were food, but they're being used by the body as if they were drugs. So these are sugars, flour, gluten, excessive salt, dairy, excessive fat, caffeine, and food additives. And then some people are allergic to clean foods. So one of the great assets of the rock is that you get a process whereby you figure out the best foods for you. And it frees you, it liberates you from having to depend on somebody to tell you what to eat. I don't know what anybody should eat. I don't even know what I should eat until I'm eating it sometimes. Do I need this much or do I need that much? Well, I did a lot of work today, so I probably need something extra. I can feel that I need more food. That's respectful. That respects you. It respects your experience. It respects your knowledge. It respects what you know about yourself. And you put together a clean food plan that works for you. It's not going to look like anybody else's food plan. Mine doesn't. Nobody could eat my food plan. I couldn't eat anybody else's food plan. This is a huge benefit. All right, I bet by now you would really like to know more. You would like to sit and talk with somebody about how this works. So please email us, info@processedfoodaddiction.com. info@processedfoodaddiction.com. Or visit our website, remissionoptimistic.com. remissionoptimistic.com. And there you will see a calendar. You just click on it and one of our outreach members will visit with you. Let's just start to have fun in your life. Put these conditions into remission. Don't let anybody hold you back. Don't let anybody tell you that's ridiculous. Don't let anybody tell you that won't work. You just trust your own intuition and come and visit with us. I'm excited for you. You've got new information here. I'm just so excited to meet you and walk this incredible walk with you. Thank you for your time today.